Hello, my name is Adam Riedel. This is my BSN266 intravenous fluid and medication administration video. For this, I need a few things, that being a 100 milliliter normal saline bag, a 250 milliliter normal saline bag, some alcohol swabs, a medication labels for the pretend amoxicillin, which we have here, some gloves, a hand sanitizer for hand hygiene, some primary tubing and some secondary tubing and some primary tubing. The primary being for our 250 normal saline, the secondary being for the piggyback for the amoxicillin order that we have, which the amoxicillin or the orders that we'll be administering today for this patient is going to be giving 150 milliliters of normal saline in an hour, and then also a administration of amoxicillin 250 milligrams that's constituted in 150 milliliter normal saline to be delivered within 15 minutes. So that's going to be kind of a faster drop rate. So what we're going to do is I'll figure out my drip rates and I'll talk about that whole thing, and then I'll go ahead and go through the actual setting everything up and all of that. This entire time I'm doing this, I'm going to want to make sure I'm thinking of the 6 patient rates of medication administration, that being the right patient, the right time, the right documentation, the right route, the right medication, and the right order. All those being reviewed, and then I'm going to be in my patient's room introducing myself to them if they haven't already met me, kind of going over the administration of the fluid because of potential hypovolemia, or we just want to make sure that they have a little bit better hydration, as well as making sure that they are aware of the amoxicillin administration, amoxicillin being an antibiotic, and so we want to make sure that we let them know the side effects and things to expect with that, and also importantly, if they had an allergy to amoxicillin, that would be very crucial to make sure that we are checking before administering any medication for that instance. So for this, I'm going to use some hand hygiene, and what we'll do is for the 150 milliliters in an hour, what you do is you take 150 milliliters or 150 divided that by 60, and then that's 2.2, so that'd be 2.2 mLs a minute. The GTT is going to be the drop rate, the drip factor, and that's going to be on most packaging for most IV kits. So typically 15 is going to be the default, but you might have something like micro drip that might have a different drop rate. So it's always important that if you're going to be calculating without like a smart pump, that you need to make sure that you're knowing actually what your drip rate is, depending on the tubing. Anywho, so it would be 2.5 mLs a minute if you were to divide 150 mLs divided by 60, which is 60 minutes the hour that you're taking this in, times 15, which is going to get you 37.5, which you'll divide up to 38. So it would be 38 drops a minute are what you're going to be expecting to see with the intravenous fluid. And then with the medication administration, you would have the 100 milliliters going in 15 minutes, so you're going to take the 100 milliliters, divide that by 15, which is going to get 6.66 repeating, and then you're going to times that by 15, and then that's going to get you 16 drops every 10 seconds, more or less, with this one. So it'd be 1.6, so more or less 2 drops every second with this one. So it's going to be really, really fast, so it'll be a really quick timing when we're administering the amoxicillin. So going ahead, I have my gloves on. I've already done my hand hygiene. The patient's going to have an IV in this setup. I haven't started. I'm not the one that started IV, so they're going to have an IV already that I'm going to make sure that isn't already like infiltrated, or they don't have any potential phlebitis. We're going to make sure that's a good IV site always before administering anything as well. So right now they would have something like a hep lock or what's called like a buff cap on. So we're going to go ahead and hang our bag. The hole could actually... And then I'm going to take the primary tubing. A couple things to point out in this tubing is going to be, one, the adapter at the end, which is going to go and attach to the buff cap or the lure lock that's attached to the patient's or to another Y port, which brings us to the next thing that we're going to look about is the Y port, which is this guy right here, which is what we're going to connect our amoxicillin administration to. It's really close to this adapter, and so it's going to be kind of a bummer to try to piggyback this. Not the super big fan of how close this is together. I would typically like to see it a little bit farther, so at least I'd have some slack. But anywho, and I'll show what I kind of mean in a second. But roller clamp, that's going to delegate how fast or how slow your flow rate's going to be, and it's in the on position, fully on position right here. And then when you just roll it, it squishes, kind of clinching the tubing, and that would be fully off all the way to the bottom. And then you have your chamber, which you would fill up, and you'd purge, or you would fill, take out whatever to fill this thing up with fluid. And then you have the spike, which is very sharp at the top, which you use to puncture the IV medication. So what we're going to do is we're going to have this guy going, and what I want to do is I would want to make sure there's no bubbles or anything either, and before I'm messing with the drip rate or anything like that, I'd want to make sure that I have everything set up before I'm administering and putting anything into a patient. I don't want to be messing around with the drip factor when it's in the patient's vein, so I would be doing that without that. Also, doing that's going to make sure that I'm going to have some fluid running out of here, which will help alleviate any bubbles or air leaks from happening, which is a bad thing, and you want to avoid that at all costs. So we're going to go ahead and take this off. And like I said, this is really sharp. If you're ever throwing these away and it's not attached to this, always put it in a sharps container or cut this part off. Like it's really, really sharp. Don't touch it. And so we'll go ahead and put this in here. So these are a little bit different IV bags than I've ever used. I've never actually had to do that before. Normally you just poke it in. This is going to fill up a little bit. If you want to get this chamber to fill up a little bit more, you would squeeze it and squish a little bit to purge it. I don't know if you can actually see that. I'll bring it a little bit closer to you. But as you can see, that's the drip rate right now where it's going. And what we're going to do is we're going to make sure that that is going at 38 drops per minute to make sure that we're getting that 150 milliliters every hour, which is going to be a little over half of this bag in an hour. So what we're going to do is I'm going to time it with my watch here, and I'm going to want 38 within the minute. So it would roughly be about one every 2 seconds, more or less. And a lot of the times too, this isn't what you're necessarily going to be doing. You would be using a smart pump or an electronic pump that would help assist with making sure that this is a totally accurate drop rate and everything, or drip rate rather. And so what we would do here is I would want to make sure if my patient's lure lock has not been swabbed with alcohol, I would use alcohol and swab that before then taking the adapter thing off here and connecting this then to my patient. And then what we're going to want to do is we're going to want to administer the amoxicillin. So what we're going to do is remember our order when we're remembering these 6 patient rights of medication, which are the right patient, right time, right route, right documentation, right order, right medication. And so what we're going to do is we have our 150, our 250 milligram amoxicillin that's going to be constituted in 150 milliliters. So we're going to pretend that this is already in here because it's not necessarily the right things to push this dry medication into this 100 milliliter bag. So we're going to pretend that amoxicillin is being pushed through here. And then we're going to administer this 100 milliliters within 15 minutes, and that's going to get us 16 drops every 10 seconds. Pretty darn fast. We're going to spike this with our secondary tubing. And the same thing as before, I don't want to push this into my patient's vein while I'm figuring out the drip factor. Another thing with this too, it's called a hanger. I'm going to want to what's called piggyback this antibiotic over these normal saline regulars. So what we do is you would just put one part of the hanger like so. And then the second one would go right here. So now it's almost like the antibiotic is getting piggybacked from the normal saline because the normal saline or the amoxicillin is going to eventually attach into this lower lock. So we're going to want to make sure that our drip rate is good. And like I said, this one's going to be a pretty fast rate because of how fast we're going to be wanting to administer this medication. And same as before, when we're attaching the IV to the lower lock left cap of the patient, we're going to do the same to the port. So we're going to take that. And like I said, it's kind of hard because this is so close to the patient. This would be, in the bed. And this is all we have in terms of tubing. It's not necessarily ideal, but you do what you can. And so we would take the adapter off, and then we would place that onto our Y port, looking something like that. That medication is going to be running, and we're going to make sure that our drips are happening with both of our medications still, which we see that they both are. So we're looking good. If we didn't see that they were dripping still, we would have potential cause for concern for infiltration or something like that. We would want to check their IV site and make sure that that's still looking okay. I would also want to make sure that taking my gloves off, performing hand hygiene before I leave the room, I would want to make sure that I'm going to label my medication, amoxicillin, with what it is. That way there would be no potential cause for error with other employees or healthcare workers not knowing what that medication running would be. I would make sure my patient is comfortable and that they were aware of any potential side effects with the administration of the fluid and medication, and I would go and document all of this that I did, and that is it. Thank you very much.